doctors can spot life-threatening conditions just by looking at your hygiene. Most people think health is all about lab tests and x-rays, but seasoned doctors, especially those treating older adults, know a powerful truth. The smallest hygiene details often reveal the biggest medical dangers. In this section, we'll look at two of the most commonly overlooked, yet critically important hygiene errors many seniors unknowingly make every day. Mistake 1. Poor oral hygiene. A dirty mouth can lead to a failing heart. When was the last time you really examined your toothbrush? Is it frayed? More than 3 months old? Do you brush for 2 full minutes? Do you floss every night? If not, you could be risking much more than tooth loss. According to Harvard Medical School geriatric specialists, bacteria from inflamed gums can enter your bloodstream and attach to heart valves, leading to life-threatening infections, strokes, and even increased dementia risk. Let me tell you about Sylvia. Sylvia, a 68-year-old retired teacher, thought bleeding gums were just part of aging. But during a routine exam, her cardiologist found dangerous inflammation in her heart valves, caused by bacteria from her mouth. The doctor told her, if you had waited a few more months, this could have killed you. That's when Sylvia started saying, I brush my teeth now for my heart. What you can do right now, replace your toothbrush every 3 months. Use an electric toothbrush. Studies show it removes 62% more plaque. Brush twice daily for 2 minutes each time. Floss every night, no exceptions. Visit your dentist twice a year. Even if you wear dentures, watch for bleeding gums, swelling, or tenderness. These aren't normal signs of aging. They're red flags. Your gums aren't just about looks. They're a mirror of your heart's health. Mistake 2. Infrequent bathing. Your skin is speaking. Are you listening? It's common for seniors to bathe less often, especially in colder months. I don't sweat much. My skin gets dry. I'm not going anywhere anyway. But here's the truth. Your skin is your body's largest organ and one of its earliest warning systems. Dermatologists from the Mayo Clinic warn that reduced bathing can hide crucial signs of serious internal illness. Dry patches, unexplained itching, discoloration, and rashes may signal liver dysfunction, diabetes, early kidney disease, circulatory problems. But you won't notice them if you're not looking, and you won't be looking if you rarely bathe. Clarence, a 77-year-old retired postal worker, thought once a week showers were fine. But during a checkup, his doctor noticed odd skin discoloration on his back. Further testing revealed early-stage kidney disease, something that could have progressed silently if not caught in time. What you should do starting today: bathe at least 3 times a week. Use mild, fragrance-free soaps to protect natural oils. Apply moisturizer while your skin is still damp after bathing. Carefully inspect your skin. Look for color, changes, persistent itching, patches that won't heal. Don't ignore dry areas. They might be your body's way of waving a red flag. Your skin doesn't just cover you. It communicates for you. Don't let its voice go unheard. The details doctors never miss: nails, toilets, and ear picks. It might seem odd, but doctors can learn a lot from small hygiene habits. Long, thick nails, toilet wiping habits, frequent ear cleaning. Each one is a clue, sometimes pointing to serious health risks hiding in plain sight. Let's break down 3 more hidden hygiene dangers. Mistake 3. Neglected nails. A window into nerve and circulation health. Do your toenails feel too thick to cut? Do they curl inward, hurt when you walk? These might look like cosmetic issues, but they often signal deeper health problems. Poor blood circulation, common in diabetes and high cholesterol. Nerve damage, reduced sensitivity to pain or pressure. Fungal infections, often triggered by immune system decline. One patient of mine, a 71-year-old man with diabetes, walked into my clinic limping. His toenails were thick, yellowed, and curling like seashells. When we checked, his foot nerves were severely damaged, and an infection had spread deep, almost requiring amputation. What to do? Inspect your fingernails and toenails weekly. Keep nails trimmed straight across, not too short. Watch for changes in color, thickness, or shape. Seek medical help for ingrown or fungal nails. Diabetics should have regular foot checks and wear breathable shoes. Nails don't just need trimming. They tell the story of your blood, nerves, and immune strength. Mistake 4. Poor wiping habits. Small error, major infections. It may feel like a private issue, but how you wipe after using the toilet can affect your entire urinary tract, especially for older women. Why? Because the distance between the anus and urethra is short, making it easy for bacteria, like E. coli, to migrate and cause urinary tract infections, UTIs, bladder infections, kidney infections. One elderly woman I treated came in with fever and back pain. She had been wiping from back to front. The result? A kidney infection from gut bacteria, avoidable with better habits. What to do? Always wipe front to back. Consider using water or fragrance-free wet wipes. Keep the genital area dry and clean. Wear breathable cotton underwear. Seek help if you have frequent UTIs, itching, or unusual discharge. Sometimes, the way we clean can invite the very illnesses we try to avoid. Mistake 5. Habitual ear cleaning. When good intentions hurt. Many seniors love to clear their ears. They say it feels good, but from a medical standpoint, it's a dangerous habit. Earwax is natural and protective. It traps dust, prevents infection, and keeps the ear canal moist. Constant cleaning can cause tiny wounds in the ear canal, infections, push wax deeper, blockages, damage the eardrum, hearing loss. One patient had chronic yellow discharge from his ear. We found a broken cotton swab tip lodged deep inside from weeks ago. What to do? Don't clean your ears unless wax is blocking your hearing. If you feel fullness, see an ENT doctor. Never dig yourself. Use a towel to dry ears after bathing. If itchy, use doctor-approved eardrops, not metal tools or pins. Sometimes, leaving your ears alone is the best care of all. Clean feet and fresh clothes. Or hidden health hazards? You might not think much about your socks or laundry detergent, but doctors do. What's on your skin and under your feet often tells more about your immune system, hygiene practices, and infection risks than any blood test. Let's look at 2 last hygiene mistakes that carry big consequences. Mistake 6, damp shoes and dirty insoles. Foot fungus is just the start. Rainy day, wet shoes, re-wearing socks 2 days in a row, infrequently, washing insoles. Many seniors do this out of habit, but it creates the perfect breeding ground for persistent athlete's foot nail fungus, thick, yellow, hard-to-treat toenails, eczema, cracks, and skin breakdown. Weakened foot immunity, especially dangerous for diabetics. One of my patients, a 76-year-old woman, had itchy, peeling feet for years. She tried creams, powders, ointments. Nothing worked. Then we looked at her shoes. The insoles were moldy. The fabric lining was damp. She had no idea. After replacing her shoes and drying her socks daily, the problem disappeared. What to do? Change socks daily, preferably to breathable, absorbent cotton. Let shoes air out at least once a week. Wash or replace as insoles every month. Thoroughly dry feet after bathing, especially between toes. At the first sign of nail thickening, discoloration, or odor, seek help. Clean feet, clear pathways for circulation, nerve health, and infection prevention. Mistake 7, residue on clothes. When fresh smell isn't so fresh, many people equate clean with fragrance, but overly scented detergents, fabric softeners, and spray fragrances often contain artificial dyes, preservatives, allergenic perfumes. These may cause chronic itching and rashes, low-grade respiratory irritation, eye dryness, and throat sensitivity. Especially for seniors, whose skin is thinner and more absorbent, these substances can lead to low-level, daily inflammation. And since clothes are in contact with your body for hours, even during sleep, any chemical residue becomes a long-term exposure. What to do? Switch to fragrance-free, dye-free, low-residue detergents. Rinse clothes with an extra clean water cycle. Wash undergarments, pajamas, and pillowcases every 2 to 3 days. Avoid spraying perfume or fresheners on clothes. If you suffer from chronic skin irritation or cough, consider changing your laundry products first. Sometimes your allergic symptoms aren't from outside. They're wrapped around your body. Doctors aren't magic. They just know what to look for. People often ask me, how can a doctor just look at my hands or feet or shirt and tell what's wrong inside? Here's the truth. Doctors aren't fortune tellers. They're observers. They know where the body whispers before it screams. Medicine isn't always in machines or scans. Much of it lives in how you brush your teeth, how often you shower, how clean your socks are, and how long your fingernails have been ignored. Great doctors look for the quiet clues. A thick toenail, yes, there's possible diabetes or circulation trouble, earwax buildup, infection risk or hearing decline, persistent odor, fungal growth or hygiene, neglect, fragrant clothing, possible allergic reaction, poor wiping habits, hidden infections. Your body leaves signals everywhere. The real question is, are you listening? Cleanliness is not optional, it's foundational. When we're young, we think hygiene is just a good habit. But as we age, hygiene becomes preventative medicine. You don't need supplements. You don't need expensive tests. You just need to look at your skin, feel your nails, notice when something's off, and respond. Early, gently, wisely. This isn't about fear. It's about being present with your body. Be your own everyday examiner. You don't need a stethoscope. You just need a mirror, your hands, and 5 extra minutes a day. Start small. When brushing, check your gums. When drying your feet, examine your toes. When dressing, look for skin changes. When toileting, check how you clean. When something feels off, don't ignore it. These aren't chores, they're conversations with your health. You may not be a doctor, but you're the only one with you 24/7. That makes you the most important health worker in your life. Remember this, when you treat your body with care, your body will return that care with time. We can't stop aging, but we can age with dignity, with awareness, with protection, with grace. It starts not with a hospital visit, but with a clean towel, not with a prescription, but with a pair of dry socks. So yes, the details matter, because your body is always talking. And when you listen, you don't just survive longer, you live better.